Once you've submitted your report, CureID moderators will be alerted and will review it to ensure it meets the guidelines and that no personally identifiable information has been accidentally included. If it passes the review, they will then approve it, which makes it public. You'll be able to see it in Explore under long COVID case reports, along with all those cases submitted by other patients, care partners, and healthcare providers. If you want to dig into the data, click Explore to see all of the cases that have been entered into CureID. Select infection-associated chronic conditions from the list of therapeutic areas by selecting the Explore Diseases button for that section. Then select the disease card for long COVID to see all of the information in CureID about this condition. This page lists the total number of cases that have been improved in CureID for long COVID. To view these cases, select Case Reports from the tile. You can now see the top 10 drugs that have been reported most frequently across all cases for this condition. You can use the menu on the left to filter the cases to see just those that are of interest to you. For example, by selecting a symptom or a drug or choosing a particular outcome. The cases displayed will filter based on the criteria you entered. You can then clear the filters by clicking Reset from the filter menu. Next, click on the individual case cards to see the full details of the report. This shows you all of the information that was entered by a patient, care partner, or healthcare provider who entered the case. Cases submitted by patients and care partners are automatically anonymized. Healthcare providers have the option to have their name shown as the author of the case, or they can anonymize the submitted report if they prefer to do so. Now that you've seen all of the cases aggregated together, as well as the detailed information collected through the long COVID case report form, I hope you can see the value of CureID and the power of each person sharing their treatment experience on the platform. Your experience may help another patient who is struggling to find effective long COVID treatments or prevent them from trying something that may be ineffective or cause them harm. In turn, the data collected from others may help you. We believe that collecting this information in the same way from everyone and making it openly available to the community will help identify treatments for long COVID that look promising and should be studied in randomized controlled trials. In addition, it may identify treatments that do not seem to benefit patients and shouldn't continue to be tried. Sharing your treatment experience on CureID brings us one step closer to identifying treatments to help patients suffering from long COVID. So thank you for sharing your experience and being a part of the CureID community.